Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee. Currently, I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS navigators are online throughout today's program, answering those questions and connecting you to resources. I'd like to take a moment to acknowledge and thank today's contributing national sponsor, Genentech. Support from MS community partners helps the National MS Society achieve its goal of providing up-to-date information and support through programs like Ask an MS Expert. This month, we celebrate Black history and culture, and as we recognize the many achievements of African Americans, we also acknowledge the ongoing work necessary to ensure equal treatment for all. Joining us today to discuss how multiple sclerosis uniquely impacts the Black community is Dr. Jacqueline Rosenthal, a neurologist at the Shepherd Center's Andrew C. Carlos Multiple Sclerosis Institute in Atlanta. Welcome, Dr. Rosenthal. Thanks for being with us today.
Hi, thank you so much for having me. I'm excited to be able to be here and talk with you about this.
You know, for decades, it was commonly thought that MS affected young women of Northern European descent, but recent research indicates otherwise, revealing a higher incidence of MS in Black people than previously thought. Dr. Rosenthal, can you explain what these more recent findings mean?
Well, the short version really is that MS affects Black people, and it's an outdated thought process to think that it only affects young white women. Black people are probably the highest, the group with the highest rate of increase right now. And so it's really important when we're looking at timely diagnosis and treatment.
Does MS affect the number of women and the number of men in the Black community differently?
So generally speaking, women of any race are going to be affected more with relapsing remitting MS. And looking at the Black community, Black women are the highest group right now in terms of the rate of increase with multiple sclerosis. It's kind of rapidly growing here. When you're looking at other subtypes of MS, primary progressive MS, the gender differences are certainly less pronounced, but generally speaking, women of any race are going to be diagnosed with MS more frequently.
And what about genetics? Do genetic factors also play a role in determining who develops MS?
They do, and it's really complicated. We know that genetics alone aren't enough to result in someone developing multiple sclerosis. It really looks to be a combination of a genetic predisposition, and then with that, environmental and geographic factors contribute as well. And just looking at the genetics, the different variations that are out there, the different genetic variations, is over 200, so there's a lot. So again, just having that genetic variation isn't enough. And then when you're looking at differences between racial groups, you have to look at the history of our country, and that, you know, Black Americans have a very varied genetic background. And so looking at some of those genetic variations, for example, we know that there's one associated with European ancestry that really does increase the risk of developing MS. But again, there are going to be people who identify as Black that are going to have that genetic background. There are also different genetic variations associated with African ancestry that we know are, for example, associated with having an earlier onset of MS. So someone could have one or both of these things, and you can't really tell necessarily just from looking at somebody. So it makes the genetics very complicated, especially looking at a country as diverse as ours and such a varied genetic background. It's not straightforward. There's a lot of work to do in looking at genetics and really digging into the meaning of everything.
We heard from Angela, who said her MS diagnosis was delayed by several years because her healthcare providers didn't consider that MS was even a possibility because Angela is Black. Is this a common experience? And if it is, why is it happening?
It happens because there is still that, outdated view that Black people don't get MS or don't get it as frequently. And I would argue that the majority of people who specialize in MS and treat a lot of MS patients don't necessarily believe that or think that anymore. We know very much so that Black people get multiple sclerosis, but there are still healthcare providers out there and people who don't necessarily think of MS as early as they should because of that outdated thought process.
Well, speaking of thinking about MS early,
Mm-hmm.
are there any cultural differences in the Black community itself that could result in someone getting diagnosed at a later age?
This is a complicated topic as well, but there are things that I think we see a little bit more commonly within the Black culture, the Black communities. Probably more at the forefront really is going to be a sense of distrust sometimes towards the medical community. And a lot of that is going to go back to the history of things that have happened in this country and ethical practices, that sort of thing. And that translates through generations sometimes. Oftentimes, the Black community relies a lot on the opinions of family members and friends. And if one person, either the patient themselves or someone close to them, have had bad experiences with the medical community, that can translate into kind of a general unwillingness to trust. And I think separate from that, what can sometimes delay a diagnosis is when symptoms occur, not necessarily acknowledging them. Sometimes there's a tendency to push through and keep going. When you look at relapsing remitting MS in particular, oftentimes those symptoms will get better. And so when they get better, sometimes it's easy to just kind of keep going and maybe ignore that something may be actually going on that's deeper than that. So I think those things together sometimes contribute to that delay.
Well, in spite of an increased awareness about MS in the Black population, the spectrum of health outcomes and even access to care varies widely. What are some of the barriers that Black people living with MS face when trying to access healthcare?
It's a good question. And we know just into that question that Black people with MS don't see MS specialists as much as their white counterparts. And that's important when you look at the disease process and outcomes and prognosis. We know that people do better when they have access to specialists. And so some of the reasons why that may be occurring, when you look at access, may be that insurance differences, not having access in that way, socioeconomic differences may play or certainly play a role. There also may be differences in referrals, or Black people being referred as frequently as white patients with multiple sclerosis. So there may be some biases there, but at the end of the day, we know that Black MS patients just aren't getting to those specialists at the same rate that our white MS patients are.
Part of living with chronic illness is learning to be an advocate on your own behalf. How can people in the Black MS community become strong advocates for themselves?
Yeah, a lot of that really is going to come down to education. There's so much to learn about multiple sclerosis. It's such a multifaceted disease, and there's so many different components. And I always, kind of harp on the fact that it's not just your one disease modifying treatment. There's all these other things that can be addressed when you look at overall quality of life and that sort of thing. And so learning about, what to expect with your disease, learning what to expect from your medical team, learning what to expect with regard to outcomes, learning about what resources are out there, what is potentially available to you to help someone do better. All of those things are really going to help promote that, and they're really important.
We heard from Malik. He says that he's worried about disclosing his MS to his friends. Specifically, he's afraid they're not going to believe him, or they're going to think of him as a weak Black man.
Mm-hmm.
Do you have any advice for Malik and others like Malik who may be having trouble disclosing their MS to friends or family?
Yeah, I mean, that kind of goes back to some of the cultural differences that we see. It's not uncommon to kind of hide that diagnosis, especially early on. I would certainly encourage Malik to kind of take it as an opportunity to educate friends and family members about the disease. I think that once people know someone with it or learn more about it, any kind of preconceived notions can go out of the window and they're better for it. And I think another, potential advantage here is that by educating other people, someone that maybe Malik doesn't know directly, that maybe knows a cousin or a friend who may be going through something similar, can benefit from the education that he has provided to his friends and family. Or, for example, maybe someone has some early symptoms that would have otherwise gone unrecognized. Now, because of that increased awareness, they may be able to be diagnosed earlier and treated earlier. And now their whole prognosis is a lot better. And so there's definitely some downhill benefits from just working to increase awareness and educate people about the disease.
Evidence shows that there are some distinct differences in how MS affects Black Americans. So let's talk about that for a moment. What can you tell us about the disease course, severity, progression among Black Americans?
Right. So when we talk about evidence, a lot of it is just kind of looking back at how patients have done. We definitely need to gather more research. And so, when we talk about some of these things, I always kind of preface it with we need to learn more. But what we're seeing are that Black people with MS tend to have a little bit more of an aggressive course. The relapses tend to occur more frequently. They can be more severe. When you're looking at relapsing MS, that period of time in between relapses when you expect recovery, sometimes that recovery is not as complete. There's a poor recovery in between relapses. There can be a faster progression to disability. And then looking at some of the MRI changes, the MRI can show increased disease activity, increased rates of brain atrophy compared to their white counterparts, as well as optic nerve and retinal changes that are a little disproportionate. So all of these things kind of are pointing towards, again, a more aggressive disease course.
Does this aggressive disease course mean that there's more progressive MS in the Black MS population?
I don't know that we have enough evidence to say there's more like primary progressive MS necessarily, but there is suggestion that Black MS patients progress to that secondary progressive MS a little earlier because of all those other factors I just discussed.
Research tells us that Black people with MS tend to have more spinal cord lesions than people of other races and ethnicities who are living with MS. Do we know why?
So we don't have a good explanation for why at this time, but that is certainly what we see. And that sometimes can lead to another delay in diagnosis when someone doesn't necessarily recognize that pattern, that difference that we see more frequently in Black MS patients, where maybe the brain is not involved so much, but you see a lot of spinal cord disease, optic nerve disease as well. And then when we talk about severity as well, when you look at spinal cord disease, that oftentimes is going to give you a lot more pronounced symptoms, optic nerve as well. So then again, that kind of goes along with part of why we are seeing more severe relapses and more severe symptoms in our Black MS population.
Given these more severe symptoms, this more aggressive disease course that we see in the Black community, are the current disease modifying therapies effective or adequate in terms of treatment?
So, the MS treatments are effective and they work for MS. I think the question really is, are the MS treatments as effective in Black individuals with MS as they are in white, which is the vast majority of what our MS clinical trials, treatment trials are the patient populations are primarily white MS patients. And so that does need to be better characterized, but the MS treatments that we still have, for, there's been some data in the past looking at some of the older drugs, the interferons, for example, some data to suggest maybe that the interferons don't work as well in Black MS patients compared to white. Those are very small numbers. But again, just getting more data, more research to really better characterize potential differences based off of race and with regard to response to treatment is really important.
Well, I'm glad you mentioned that the clinical trial population, if you will, the people who participate in those trials tend to be overwhelmingly white. Minorities have been historically underrepresented in multiple sclerosis clinical trials. Why is there low representation of Black people in clinical research? And I think more importantly, how do we address that?
Right. So I think part of it kind of goes back to that mistrust that sometimes the Black community has towards research. It can be scary and overwhelming, that unknown, worrying about one's safety, how the MS is going to do. Will treatments be withheld? How am I going to respond to that? These are all questions that can be scary. I think part of the way to address that really is to provide additional education about research. I also think that one of the reasons there is low participation is that in combination with that mistrust, I think that there may be a lack of awareness in the Black MS community that, hey, we're not showing up for these trials. And so with the data that you get from these trials are kind of limited being applied to us. And I think in my experience, when we talk about that, a lot of Black MS patients are very willing to participate in research. It's just maybe they weren't aware of how big of an issue it is. And so increasing awareness in that way is important. And then another problem that kind of needs to be addressed really is coming from the people who are completing these trials, these drug trials, and increasing their efforts to engage with the Black community and increase the amount of participants that are Black. Research teams being more diverse will help as well. So there are certainly a lot of work that could be done to help encourage more adequate representation.
So where can someone learn more about the research opportunities that are out there?
So, I mean, the National MS Society certainly has lots of resources by going to their webpage, for example. A lot of things are listed. Clinical trials in particular, if you go to clinicaltrial.gov, you could, search for trials specific to what you may or may not be interested in participating in, and then just talking to your neurologist. Again, sometimes that's a benefit of seeing an MS specialist. Your neurologist may know about trials specific to your type of MS or any things that may be offered at the particular facility where you attend.
Well, I appreciate that you've shared some really important insights about how MS impacts the Black community. What would you say are the top 3 takeaways that you'd like our audience to remember?
Well, I think probably the first takeaway really would be to continue to educate yourself on MS and the resources that are available. I think, your audience here today are already doing that. So continuing to do that and get as much information as you can. I think a second takeaway really would be to try to engage in research. There are a lot of different opportunities for research. Not everything has to necessarily be a clinical trial. And so there are options to participate in research that is maybe a little less invasive, if you will. And so I would encourage everyone to try and take some steps to look at that, sign up for a registry, just try to put in some time to effort towards better adequate representation and research. And then a third takeaway really would be to try to support others in the MS community, the Black MS community in particular, by spreading word. With that, I do believe that, the awareness will go up, that it will help kind of combat the delay in diagnosis that a lot of Black MS patients face.
Well, thank you so much for sharing your expertise with us, Dr. Rosenthal. Let's continue answering questions from some of our viewers. We heard from Alana, who wants to know the best way to break down the barriers in healthcare that minority groups face.
I really think that just focusing on education and advocacy, and again, there are a lot of different ways to accomplish that. Checking in with local support groups, your National MS Society chapter, there are opportunities to help kind of address barriers with access to care and that sort of thing. And so again, just through education and advocacy, I really think is the best way at this time to try to break down those barriers.
Jamal is wondering how people in the Black MS community can raise awareness about the way they experience MS and their unique needs and challenges.
So, I mean, this day and age, a lot of people really are utilizing social media as a platform to spread word about their own experiences. And so that's certainly an option. There are other avenues as well. For example, with the National MS Society, the MS Black Experience Summit, we oftentimes will invite patients to come kind of tell their story and help others in that way. And so those are just a couple ways to try to spread information.
We heard from Kyla, who says, as a newly diagnosed Black woman, where can I find support from other Black women living with MS?
So that's easier in some places than others. It kind of depends, on that a lot. Here in Atlanta, we have a very large patient population of Black women with MS. And I know, for example, that there are support groups in this area with only Black women. And so that unfortunately isn't always going to be an option for everyone. But also, I think one of the things that we can take advantage, especially since COVID, is there are a lot of things that are being done virtually in terms of contacting and reaching out to people. There is a group as well that I've heard of, We Are Ill, that is Black women supporting each other. And so there are certainly some options out there to try to fellowship with and support other Black women with multiple sclerosis.
Rochelle wrote in asking whether Black women are at a higher risk of developing MS than Caucasian women, and if so, why?
So Black women are, this is more recent data that shows that Black women are the fastest growing group of people diagnosed with multiple sclerosis. The reason why is we don't know right now, honestly. Again, when we look at what causes MS, it's so varied and so multifactorial, and there's a lot to be determined. My suspicion is that there probably are some genetic and environmental factors that are contributing to that, but we don't know right now.
Well, I want to thank everyone who submitted some excellent questions, and thank you for being with us today, Dr. Rosenthal.
Thank you for having me.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends, ways for you to get involved, and upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find the Real Talk MS podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Dr. Rosenthal for joining us today. Please remember that a recording of this webinar will be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webinar is important. So you'll see a survey pop up in a moment when we close out the webinar. And if you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Jacqueline Rosenthal and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.